Okay, Jason, I'm letting everyone in. Please go ahead in 5 seconds.
Good morning, bon matin à tous. My name is Jason Haug and I will be your moderator for today. Je m'appelle Jason Haug et je serai votre modérateur aujourd'hui. Thank you for joining us for today's media availability on COVID-19. Merci de vous joindre à ce point de presse au sujet de la COVID-19. The view who is speaking in Zoom, please put your view on speaker view instead of gallery view. The button for this is located on the top right corner of the Zoom video screen. Veuillez changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin the interpreters, Christopher and Hélène, or follow along on YouTube. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes, Hélène ou Christopher, ou suivre la diffusion YouTube. Today we'll be hearing remarks from nos porte-paroles aujourd'hui seront Councillor Keith Eglai, Chair of Ottawa's Board of Health, Conseiller Keith Eglai, Président, Conseil de Santé, Santé publique Ottawa, Dr. Vera Etches, Medical Officer of Health, Ottawa Public Health, Dr. Vera Etches, Médecin-Chef en Santé publique Ottawa, and Dr. Brent Malachny, Deputy Medical Officer of Health, Ottawa Public Health, Dr. Brent Malachny, Médecin-Chef adjoint en Santé publique Ottawa. Following the remarks, we will take questions from the media. A friendly reminder to please keep your microphone on mute until I invite you to ask your question. Veuillez désactiver votre microphone jusqu'au moment de poser votre question. I'll now hand it over to Chair Eglai. Chair, over to you.
Thank you very much, and good morning, everyone. Bonjour, Kwe. I want to start off by thanking the media once again for assisting us in getting vital information out to the community around our continuing issues with COVID-19 in the city. We're here today to provide an update on COVID-19 in Ottawa and our progress with vaccinations. But first, I'd like to begin by acknowledging that yesterday was Overdose Awareness Day, an annual campaign to end overdose, remember without stigma those who have died, and acknowledge the grief of the family and friends left behind. To help bring awareness to this serious public health issue, an event was held at City Hall yesterday, and I'd like to thank the organizers for their tremendous work in coordinating it. But I'd also like to take a moment to recognize our partners in the community and health sectors, including harm reduction advocates, for their ongoing dedication and efforts to improve health for those people using substances and their families. It is vitally important that we continue to advocate for systematic changes to be made at all levels of government to better support everyone in our community. I'd also like to take some time to recognize yesterday's provincial announcement regarding the implementation of a vaccination program for higher risk settings in Ontario. It is hoped that this program will help prevent further economic and social disruptions in the weeks ahead. This morning, Ottawa Public Health has also released guidance for how to develop and implement workplace vaccination policies to better support local employers. I encourage all employers to view the policy on OPH's website. In addition to this, OPH has updated its existing employee immunization policy with a new requirement for all employees to provide proof of full vaccination against COVID-19. With increasing numbers of new COVID-19 infections, and with the highly transmissible Delta variant now in our community, the need to protect and support the health of both employees and residents must remain our primary concern. Vaccines are proving to prevent infections, to be highly effective against serious COVID-19 infection, and decrease transmission of the virus, making them an important support for our occupational health and safety. Later, we'll be hearing from Dr. Etches about the increase in the number of people testing positive for COVID-19 in Ottawa. We can understand how this may add stress to families already anxious about the beginning of the school year. While there are many things outside of our controls as individuals, there are also many things we can do to protect ourselves and our loved ones from COVID-19. As a community, we need to continue to do our part to keep COVID rates down so we can keep the virus from being introduced into school settings. With the fall season in our sights, and with the more transmissible Delta variant in our community, Dr. Etches and Ottawa Public Health are encouraging everyone to take what steps they can to prevent transmission. Get immunized if you haven't already. Maintain public health measures like masking and distancing. And limit your number of close contacts, particularly indoors. By practicing these actions together as a community, we can limit the extent of transmission and protect ourselves and others, including our children who cannot yet be immunized. Ottawa Public Health remains committed to supporting schools to stay open and to maintain a safer environment for students and staff. Finally, I'd like to thank Ottawa Public Health and the City of Ottawa staff for the continued hard work in responding to the pandemic and the vaccination campaign. This includes the development and implementation of local policies, of which more details will be provided during this media availability. I will now pass it over to Dr. Etches for her update.
Well,
Thank you, Chair.
Hello, bonjour, and Quay. This is a stressful time. And with the start of school and more requirements from the province, and I know that we can make it through this. So I am here today to provide an update on what we see from a public health perspective about keeping the COVID-19 situation manageable this fall. Over the last several days, we have seen an increase in the number of people testing positive for COVID-19. There were 207 new people tested positive in the previous 7 days. The percent positive, that's people going for a test who end up to have COVID, it has been higher recently than it has been in many months. And the level of the virus in the wastewater is fluctuating. What we know is a really important and key measure to watch, the hospitalizations, is that they have gone up. So we are experiencing a resurgence in Ontario that is driven by a highly transmissible Delta variant. Nous faisons face à une résurgence en Ontario qui est principalement causée par la variante Delta, hautement transmissible. So yesterday, our epidemiology team released the latest breakdown of people testing positive for COVID and hospitalizations for COVID by vaccine status. And so we see that the rate of new people testing positive in the unvaccinated population who's eligible for COVID vaccine, it's 41.3 per 100,000. While the rate of new people testing positive among people fully vaccinated is 2.7 per 100,000. So it means the risk of COVID infection among the unvaccinated population eligible for a vaccine is 15 times higher than it is for the fully vaccinated population. And we'd love to see the unvaccinated population become protected with the vaccine. Ceci veut dire que le risque d'une infection de la COVID-19 parmi la population non vaccinée qui est éligible à recevoir un vaccin contre la COVID-19 est 15 fois plus haut que le risque d'infection chez la population entièrement vaccinée. C'est important pour nous de protéger cette population pour eux. The good news is that we continue to make progress on our vaccine rollout. To date, 79% of people born in 2009 or earlier, so people 12 and above, are fully vaccinated in Ottawa. And this represents 69% of the total population. Ottawa Public Health is continuing to work hard to reach the remaining eligible population, to remove barriers, to address questions, to make accessing a vaccine as easy and convenient as possible. We understand there's hesitancy. There's a lot of disinformation. People have questions, and we're here to help answer them. So if you haven't been vaccinated yet, you are very welcome to reach out to us. You're very welcome in our clinics. Everyone will be happy to see you. And our work to continue to address people's needs and barriers to vaccination is reflected in the update on vaccination coverage by neighborhood that was published yesterday. So we see since our initial report, which included data as of August 2nd, we're now seeing improvements in both first and second dose uptake across all Ottawa neighborhoods. In August alone, we saw an increase of 7 percentage points in full vaccination coverage, and 22 neighborhoods saw an 8 or a 9 percentage point increase in full vaccination coverage. So to see more of this data by neighborhood, you can visit the neighborhoodstudy.ca. The link is neighborhoodstudy.ca. Ottawa Public Health is supportive of policies that increase immunization coverage in our city, and we support the province's announcement to require proof of vaccination to access certain businesses and settings as outlined in the provincial announcement. Santé publique encourage et est reconnaissante des politiques qui augmentent la couverture vaccinale dans notre ville. Nous appuyons l'annonce provinciale de devoir demander pour une preuve de vaccination afin d'accéder à certaines entreprises et espaces tels que spécifiés dans l'annonce provinciale. All Ottawa residents who have received 2 doses of the COVID-19 vaccine currently have access to a paper or a PDF vaccine receipt that includes all the relevant information to prove that they are fully vaccinated. So individuals can provide this proof of immunization by downloading or printing their vaccine receipt from the provincial booking portal, or by calling the provincial vaccine booking line at 1-833-943-3900. And I want to let people know that you can also visit one of Ottawa Public Health's neighborhood vaccination hubs if you don't have access to a printer. Our public health staff will be happy to help you get a proof of vaccination. And if you need a vaccine, again, it doesn't hurt to say that Ottawa Public Health is offering vaccine clinics daily at community clinics and neighborhood vaccination hubs. There are no appointments necessary. You can drop in, and more information is on our website. So our goals remain the same in this pandemic response. We are working to decrease death, and we have seen the great effectiveness of COVID-19 vaccines in achieving this. We're aiming to keep a functioning healthcare system for all of the healthcare needs that people have, and to avoid the societal disruption of schools closing or a lockdown. And so approaching September with caution is key. In addition to getting fully vaccinated, we can achieve our goals by maintaining the public health measures that we've come to know so well and choosing safer activities. So this means gathering in well-ventilated areas, especially outdoors, keeping gatherings small, avoiding large crowds where masking and distancing can't be maintained. Nos objectifs demeurent de réduire le nombre de décès, et nous voyons l'efficacité des vaccins contre la COVID-19 pour y parvenir. De maintenir un système de soins de santé fonctionnel pour tous les besoins en soins de santé, et éviter la perturbation sociétale de la fermeture des écoles et le confinement. So with the latest COVID numbers and the modeling that are concerning, I'm still hopeful. I'm hopeful because we've beaten the odds before. I've seen Ottawa persevere. I've seen people come together as a community while staying 2 meters apart to support one another. The Delta variant is presenting challenges, but we've learned a lot in the last 18 months. We have the tools, we have the knowledge and resilience to get through this next phase. Thank you, merci and miigwech. Pass it over to Dr. Malachny.
Thank you, Dr. Etches. The province's announcement to require proof of vaccination is another step that will help us get to at least 90% vaccination coverage here in Ottawa, as well as reduce the risk of transmission in higher risk settings. This new policy will cover those who attend and access certain businesses and services. In addition to the provincial announcement about vaccine certificates, another type of policy that will help reduce transmission of COVID-19 is about promoting vaccine coverage among employees and workplaces. When it comes to businesses and workplaces, Ottawa Public Health strongly recommends that all Ottawa employers implement workplace vaccination policies for staff to reduce the risk of COVID-19 transmission. To support this recommendation, we have released guidance available on our website to assist employers in the development and implementation of their workplace vaccination policies as part of their COVID-19 safety planning. En plus de l'annonce provinciale concernant les certificats de vaccination, Un autre type de politique qui contribuera à réduire la transmission de la COVID-19 concerne la promotion de la couverture vaccinale parmi les employés dans les lieux de travail. Santé publique Ottawa recommande fortement à tous les employeurs d'Ottawa de mettre en œuvre des politiques de vaccination du personnel en milieu de travail afin de réduire le risque de transmission de la COVID-19. Employers have a responsibility to maintain a safe work environment for their employees. Supporting employees to get fully vaccinated is the best way to help protect them from the risks of COVID-19, prevent outbreaks, and build confidence in the workplace as we face a more transmissible Delta-fueled resurgence in our community. When developing a vaccine policy, employers should continuously assess the risk of transmission at the workplace by considering several factors. For example, are workers required to be in close contact with others in their place of work or while performing their work duties? Can workers keep at least 2 meters apart while performing their work? How long and how often are workers in close contact with other workers or customers? And what is the size of the workforce and what is the vaccination rate? Ottawa Public Health has used a similar approach in the development of our own workplace vaccination policy. For our organization, we gave particular consideration to the vulnerability of many of our clients to whom we provide direct services, the need to maintain our operations throughout a resurgence, and the effectiveness of vaccination compared to relying on testing. As such, we are updating our existing employee immunization policy to include the new requirement for all OPH employees to provide proof of vaccination, full vaccination against COVID-19. Supports are available for vaccination in workplaces, community organizations, places of worship, and other groups that can contact Ottawa Public Health to request a mobile vaccination team to administer first and second doses of the COVID-19 vaccine on site at their own location. Please visit our website or call 613-580-6744 to request a mobile vaccination team. Du soutien est disponible pour la vaccination au lieu de travail. Les organismes communautaires, les lieux de culte et d'autres groupes qui peuvent communiquer avec Santé publique Ottawa pour demander à une équipe de vaccination mobile d'administrer les premières et deuxièmes doses de vaccin contre la COVID-19 sur place à leur propre établissement. Veuillez visiter notre site web ou composer le 613-580-6744 pour demander une équipe de vaccination mobile. Of course, in addition to implementing a vaccine policy, workplaces must continue to review and update their COVID-19 safety plans as required. This is particularly important considering the changing context due to the Delta variant. More information on COVID-19 safety plans can be found on our website dedicated to businesses and workplaces. Now, I've heard from some parents and guardians who are concerned about a return to in-person learning and, like us, want to ensure a return to school that is as safe as possible. Layers of protective measures will again be important this year. This includes daily screening, masking, distancing, as well as our investigation and control measures if someone with COVID-19 has been at school. I want to remind parents and caregivers to continue daily screening for COVID-19 symptoms. Ottawa Public Health is currently updating our screening tool following provincial changes. In the meantime, parents can use the province's school and childcare screening tool. Now, screening will be a little bit different this year. The Ontario government recently removed some COVID-19 symptoms from their screening tool, including having a runny nose or sore throat. The symptoms that remain on the tool include fever and/or chills, cough or a barking cough, shortness of breath, decrease or loss of taste or smell. Our advice to parents and guardians is if you or your child experience any of the symptoms listed in the screening tool, do not go to work or school. Seek testing right away and remain in isolation until the result is available. I want to remind parents and caregivers that there are several sites across the city that will test children. A full list of testing sites is available on our website and on ottawatestingupdate.ca. Le conseil que nous donnons aux parents et aux tuteurs est le suivant. Si vous ou votre enfant présentez l'un des symptômes énumérés dans l'outil de dépistage, n'allez pas au travail ou à l'école, Faites-vous faire passer un test de dépistage pour la COVID-19 immédiatement et restez en isolement jusqu'à ce que le résultat soit disponible. Je veux rappeler aux parents et aux proches aidants qu'il y a plusieurs endroits que vos enfants peuvent faire passer un test de dépistage pour la COVID-19. Une liste complète de ces sites est disponible sur notre site web et sur ottawatestingupdate.ca/fr. Additionally, new this year, take-home tests will begin rolling out across many schools in Ottawa, making it easier and more convenient for parents to test their children. More information on what to expect for testing this school year can be found on ottawatestingupdate.ca. Now, if you or your child experiences any other symptoms of illness, like a runny nose or a sore throat, you do not need to seek testing. However, you do need to stay home until you're feeling better. Si vous ou vos enfants présentez n'importe quel autre symptôme de maladie, comme un mal de gorge ou le nez qui coule, vous n'avez pas besoin d'aller faire passer un test de dépistage, mais vous devez rester à la maison jusqu'à ce que vous vous sentez mieux. Daily screening for students and staff is an important component for keeping schools as safe as possible this fall. Thank you. Merci. Miigwech.
Thank you, Dr. Malakny. I will now invite each media agency in reverse alphabetical order to ask their questions. Please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inverse. Chacun pourra poser une question ainsi qu'une question de suivi. We will start with TVA, Catherine Fortin. Please go ahead. So that's just a call. I'm not seeing Catherine on the call, so we will go to Radio-Canada, Samuel Blais-Gauthier.
Oui, bonjour. Ma question est pour Dr. Etches et ça va toucher en fait les conseils scolaires. Donc, on peut comprendre que chacun des conseils scolaires ont leur propre, ont l'autorité d'imposer ou non la vaccination pour le personnel enseignant. Qu'est-ce que la santé publique recommande? Est-ce que la santé publique recommande la vaccination pour tout le personnel enseignant et le personnel de soutien dans les conseils scolaires?
C'est important pour tous les employeurs d'avoir une politique concernant la promotion de la vaccination et de faire l'évaluation concernant leur entreprise. C'est le même pour les conseils des écoles. Il y a différents aspects. Les conseils ont besoin de gérer leur opération et le demande du ministère de l'Éducation est la base concernant la politique et s'il y a une approche où on peut augmenter le demande pour le vaccin dans le cadre de leurs employés, c'est aussi quelque chose que la santé publique peut soutenir. Mais mon collègue Dr. Brent Malakny a aussi travaillé avec les écoles et il a peut-être il a d'autres mots, mais je ne sais pas.
Oui, en fait, s'il pouvait répondre aussi là, à savoir, est-ce que vous recommandez ou pas, ou est-ce que les enseignants, selon vous, est-ce que ce serait sécuritaire? Est-ce que vous souhaiteriez que les enseignants et le personnel de soutien là, soient vaccinés dans les écoles?
C'est important que toute la population éligible pour un vaccin est vaccinée. Ça c'est notre but. Et il y a différentes méthodes d'augmenter le taux de vaccination et les politiques des employeurs sont importantes. Mais c'est aussi important de reconnaître que les écoles ont différents niveaux de protection. La vaccination, c'est important, mais aussi il y a d'autres pratiques qui ont contrôlé la transmission de COVID-19 dans les écoles l'année passée et pour cet automne. Premièrement, c'est impossible de dire trop souvent Si vous êtes malade, si les employés sont malades, il est important qu'ils restent chez eux et faire un dépistage pour la COVID-19. Alors, chaque employeur a besoin d'évaluer les possibilités pour augmenter le taux de vaccination dans leur entreprise. Et Santé publique ici, nous avons les points d'accès, nous avons les cliniques mobiles, on peut ajouter, on a la vie et aujourd'hui, on a créé plus de documentation qui peut guider les entreprises dans leur création de leur politique.
Merci beaucoup, Dr. Etches et Samuel. On va maintenant, we're going to Elizabeth Payne with the Ottawa Sun.
Hi, thanks very much. I think this is a question for Dr. Etches. This is the second September that you have issued this warning about having to be careful and that we're facing possible increase in cases. And we've had the science table yesterday come out with models showing that the fourth wave could be worse than the third, very likely will. What is this school year looking like at this point compared to a year ago?
I do want to start again with my words of hope that we can keep this situation manageable through the fall. It will take work, but we have right now a very different situation, concerning the risk of death for older adults because of the vaccine and the high levels of vaccine coverage. There are still people at risk for hospitalization and death who are not vaccinated. We'd love to see them take advantage of that vaccine for that protection. And we know it's not perfect. That we do see with the Delta variant that it is posing challenges even to the vaccinated population. So that's where we have to use the other tools, which again, people in Ottawa bucked the trend last fall. They kept rates lower and even trending down through the autumn by using masks, by keeping distance, by choosing lower risk activities with fewer people involved with activities outdoors. So I think these are the tools we can use, and I totally understand the stress of going back to school. I have my own children in contact school, and it's something we're going to continue to assess. What's happening in the schools is always a reflection of what's happening in the broader community. And so we will continue to see what needs to be done, to keep the COVID levels manageable, keep those schools open. And we know that, the very basics, again, really do work to keep COVID out of schools. If people are sick, to stay home and get tested. So we'll continue to evaluate as we go, and I do remain hopeful.
And can I ask you what Ottawa's own modeling is saying and how that compares to what the science table's modeling says about the coming months with the fourth wave and Delta?
We don't have Ottawa specific modeling into the fall. We have had the help of local modelers at different times during the pandemic. Mostly they've been predicting a bit on the hospitalizations, and the variables have changed with the vaccine. We don't have a model specific to Ottawa that's up to date because so much has improved in being able to predict how people testing positive even translates into hospitalizations, right? It's not the same. So we do look to the provincial modeling because we're one province, we're connected. What happens in Toronto affects what happens in Ottawa, for example. There's more traveling and connections between areas than there have been. So the modeling that we saw for the province of Ontario yesterday does give us pause. Because I don't think we've heard that message for a little while about the importance to, above and beyond getting vaccinated, think about the number of close contacts that we have and how we might reduce that. And so that's again what we're speaking to, how to practically do that this fall. I think people have done it before. It's remembering that there are lower risk activities that will reduce the opportunity for COVID to be transmitted, when we're not as close to as many people without masks indoors.
Thank you so much. We'll go to Joanne Lausius from Ottawa Citizen now.
Can you hear me?
Yes, we can.
Okay. Dr. Etches, I wanted to ask you a little bit more about vaccination rates in some of the neighborhoods that where you'd seen a low uptake. What are the factors behind that?
So I spoke today about progress actually in each of those neighborhoods where we initially did see that coverage rates were lower. It was often related to communities that have less advantage. So communities where there is a greater rate of poverty, is some connection also not always, but to some neighborhoods where the percentage of newcomers or racialized populations are higher. These are populations that face greater barriers that may not have transportation or childcare or speak English or French as a first language, that are receiving potentially sometimes a lot of disinformation, promoting myths about vaccines. And so, our work has been to overcome all those different types of barriers by bringing the vaccine into neighborhood hubs, by going door to door, by working with community leaders who speak more languages. And we have seen the progress. I think that it is really encouraging. People are still coming forward for first doses, and the second doses have come up as well. So we'll continue on this path of working with neighborhoods and across Ottawa. I think we've seen every neighborhood, the vaccine rates are still going up. So I just do want to speak to people who aren't yet vaccinated. It's not too late. You're very welcome. We understand that people have barriers that have prevented them from being vaccinated to date. We understand there's questions. People need reliable information. They need time to talk it through. And so that's what we're here for, is to continue working with people to increase those immunization rates.
Thank you.
Thank you so much. On va maintenant à Émilie Pelletier, Le Droit.
Bonjour, hi. Moi aussi, mes questions sont pour la docteure Etches par rapport au taux de vaccination. À Ottawa, ça va bien. Dans la région de Leeds, Grenville, Lanark, ça va très bien. Dans l'Est ontarien. En fait, les régions les plus à l'Est de la province, le taux de vaccination, ça va bien. À quoi on peut attribuer ce si haut taux de vaccination? Puis, est-ce qu'il y a moyen de montrer l'exemple au reste de la province, selon vous?
C'est complexe. Il n'y a pas un facteur qui détermine le taux de vaccination. C'est clair que quand les gens ont des avantages comme la transportation, le temps d'être vacciné, ils comprennent le message, l'information, c'est plus facile. Le moyen salaire à Ottawa est plus haut, et c'est un aspect peut-être associé avec des opportunités d'avoir un vaccin plus facilement. Mais je voudrais dire merci à chaque personne à Ottawa qui a été vaccinée, et c'est comme un collectif ensemble qu'on peut gérer cette situation et trouver un meilleur avenir. Et ça prend de cette soin aux autres, mais les vaccins sont aussi importants pour chaque personne qui sont immunisées. La protection est pour les individuels et ça aide aussi la communauté. Alors, oui, c'est pas clair exactement pourquoi, mais l'équipe avec la ville d'Ottawa, avec Tony Demonté et son équipe, avec nous, à Santé publique, beaucoup de partenaires, les hôpitaux, les soins de santé communautaire, les partenaires dans la communauté, tout le monde travaille fort, et aussi faire que reconnaître que ce programme est la priorité pour aider notre population maintenant. Alors, il y a beaucoup de travail. Je peux juste aussi mentionner ça en dessous le chiffre. C'est clair, on a créé des cliniques grandes et accessibles et on a communiqué avec tous nos partenaires dans le système de la santé d'aider les médecins de famille. Ça prend toute la communauté. C'était un résultat bon pour toute la communauté. Et on continue, c'est pas assez aussi. Ça, c'est un message. On a besoin d'ajouter les autres mesures. On peut continuer d'augmenter le taux.
Merci. Puis c'est justement ma prochaine question. Avec l'annonce du certificat de vaccination d'hier, est-ce que vous pensez qu'on peut s'attendre à une hausse de la prise de rendez-vous dans les prochaines semaines à Ottawa, même plus que 90 ce qu'on vise?
Oui, je pense que ça va aider le taux de vaccination parce qu'on peut voir déjà une augmentation dans les rendez-vous pour les cliniques. Les gens qui ont présenté à notre clinique hier, le chiffre augmente déjà. C'est le but. Et j'imagine que ça va aider avec cette cible de plus de 90.
Merci beaucoup. Thank you. We'll go now to Craig Lord with Global News.
Thank you. Dr. Etches and also Keith Egley, I heard you both mention the importance of smaller gatherings ahead of the fall to keep transmission down. I'm curious if you'd like to see restrictions probably at the provincial level put back in place to limit gatherings and discourage super spreader events during the fourth wave.
I can start if you like. At this point in Ottawa, the COVID situation is manageable and we have the tools. I think we need to monitor the situation and evaluate as we go if more is needed. We know it's not just the size of the gatherings, it's whether people can distance, whether people are wearing masks, whether they're outdoors. And so it's putting these variables together. We want to keep choosing the lower risk activities. And size is one where we know people can make the choice to have fewer contacts. I don't know if others want to add.
Building on what you said, that the situation in Ottawa now is manageable, as you put it. Throughout the last year and a half, we've achieved a lot in Ottawa through cooperation and collaboration, through people, hearing advice given by Dr. Etches and her team and looking at it and saying, that's a reasonable path forward and that's something I can do voluntarily for myself and for my community. So we've seen good voluntary compliance with messaging from public health as opposed to the imposition necessarily of restrictions or limits. Our approach has always been to work with the community as much as we can. And I think this is another example of that. A lot of this, as we both said, is within your control, choices that you make. And we just would urge you to make, the best choices that you can based on the science and the medical advice that public health can offer.
Thank you so much. Do you have a follow-up question, Craig, as well?
Yes, I think this would be for Dr. Etches. The 90% vaccination goal that we have, we're slowly ticking towards it. Do you have a timeline in mind for when you think it's conceivable that Ottawa could hit that 90% mark? Is it before the end of September, or what's your pace looking like if you were to forecast that out?
I have looked at that. The pace, if it continues as is, it would be around mid-October. And that's a bit late when you compare that to the modeling from the Ontario Science Table, that the resurgence is likely going to be here, third week of September or so. it is important that people are protected as soon as possible with the vaccine. And I am encouraged that this, the ongoing conversation about the value of vaccines, the support from policies, the different access in neighborhoods will increase the rate of uptake because we've seen more traffic to our website. We've seen more people walked into our clinics yesterday to be vaccinated. More bookings are happening. So I hope that we will see actually the uptake grow more rapidly than that. And again, it is important for us to encourage others who may not be vaccinated yet to hear them out, to understand where they're coming from. People have legitimate questions. This is a choice for each individual to make. Now there are some limitations. People choose not to be vaccinated, but ultimately it's about protecting people from serious COVID illness, and everyone deserves that protection.
Thank you so much. We'll go to Josh Pringle, CTV News Ottawa next.
Thank you very much and good morning. My question is for Dr. Etches. You've said a couple times the COVID-19 situation in Ottawa is manageable and you're hopeful that we can get through this fourth wave. Given the modeling data that we saw yesterday showing a warning of a substantial fourth wave of the pandemic, are you hopeful that we can avoid another lockdown this fall?
Absolutely. This is what all of us are working for. I want to thank business owners actually specifically today, because they've worked so hard through this pandemic, adapting to a totally new situation, putting in safety plans. Today we're recommending that their safety plans include looking at vaccination policies. They're going to adapt to the requirements from the province for assessing vaccine status of their patrons. So I'm really I'm thankful for what businesses have done, and I know they're committed to ongoing good practices that help protect us and that help keep their businesses open. We have the same goal, and these policies are one extra step to assure that.
And my follow-up question, yesterday with the province announcing the vaccine passport that you'll need to show to get into non-essential businesses, you mentioned briefly that you've seen an uptick in people going to get a vaccine yesterday. Any idea how many new appointments or vaccines were received yesterday after this announcement? How many appointments were booked?
Yes, I probably can't be completely specific about the time frame after the announcement. I do think the team can probably provide that data after the media availability if you would like. It was a noticeable increase.
That's perfect. Thank you.
Thanks so much. We'll now go to Alex Gouge from City News Ottawa.
Hello. My first question is for Dr. Etches. Given the fact that the Quebec vaccine passport system is already in effect, what's your thoughts on the fact that there's still just under 3 weeks until Ontario's goes into effect, given the relationship between Ottawa and Gatineau?
Well, I think we've seen before that it's really artificial to divide our community with the river. We all travel back and forth for work or for family and social reasons. And so I think in the end, what we are recommending on both sides of the river is that, first of all, be vaccinated. And then, the other measures are in place, right? To wear masks when you're indoors in public spaces, to use caution and distancing, and be outdoors as much as you can. So I think we have then seen the COVID situation very similar in terms of rates and hospitalizations on both sides of the river. So I think we're heading towards a place where there's going to be more consistency in the requirements for businesses and access to businesses on both sides. But really all along, despite differences in provincial approaches to regulation, we've seen people really have similar outcomes.
And for my follow-up, do you feel like there's any gaps and anything missing in Ontario's proof of vaccination system that's coming?
When we're still digesting the details, and we haven't seen the regulations yet. Initially I was wondering about some of the larger gatherings outdoors, at sports events or music festivals where there are a large number of people still, and in crowded situations, that's one of the more higher risk settings for transmission of COVID. And so I think what I'm seeing, though, and recognizing is, while that wasn't specifically covered in the provincial program, that the enterprises involved in running festivals and sports networks have themselves stepped up to say that they will have vaccination policies in place. And so they are addressing those gaps. I want to thank them for that.
Thank you so much.
Thank you. And we'll finish off today with Kate Porter from CBC.
Hi, everybody. Thanks for taking our questions today. I have a couple for Dr. Etches. Just to jump off of Liz Payne's question earlier about this September versus last, Dr. Etches, some things are different. More kids in school, not virtual. Kids themselves are the under 12 unvaccinated populations. Sports teams are going again. I'm wondering, are you more or less concerned about kids this September, in this back to school than last, or any advice for them in particular?
What I'm even more convinced about this autumn is that students need to be in school in person for their overall health and well-being. I think we had more and more evidence grow over the course of last year about the harms that are done when children don't have the opportunity to be in school and in person. And so looking at the risk of COVID transmission is one aspect of assessing what's best for children's health, but we need to consider the other things that children need for their health. And so on whole, I'm very convinced that this is a good step to have children back in school. And then we need to use the tools that we have to decrease the risk of COVID transmission, always starting with what's happening outside the schools. What can we do as adults to protect children in schools? And here again, vaccination is the first answer, right? It's the best protection to stop COVID transmission. And after that, we have the other measures that adults can take. I do think we need to prioritize schools being open this fall by taking a look at the other places in the community where we can decrease COVID transmission. So some of these policies, some of the ongoing measures are important to be able to keep transmission low in schools. So the vaccination policies, the masking policies, all of these, and then our individual choices to choose lower risk activities. We can prioritize the health of children this fall.
And the other topic I was wondering about, the tone of confrontations, I almost want to say, over vaccination has changed since earlier in the pandemic, and business owners were telling us yesterday, they're worried about staff having to face confrontations at the door over the vaccine passports. The policies that you lay out today mention employers possibly, putting people in different positions if they're not vaccinated. And I just wonder, if you could comment a bit about that tone and what advice you have for people given these interactions that might take place in light of all of this.
Sure. I hope you are hearing from me, understanding that some people are not vaccinated at this point and they have reasons, and I respect that. I respect people's choice to be vaccinated or not. And we need to help people with the barriers that they're facing to be vaccinated. And we need to show kindness to people who are not vaccinated yet, and each other, all of us. This is a hard time. Things have been moving fast. Information changes. We need to support each other. And so what we see is that it is also important to protect the safety and security of people in our community by promoting higher rates of vaccination. And so, the requirement for entering into some non-essential businesses, I think that's the language the province was using. This is a helpful step to get the vaccination rates higher to protect the population. It doesn't require confrontation, in terms of, we're not asking businesses to be police. And businesses have gone through this before with the mask bylaw and masking requirements of the province. There is not an expectation that people are entering into a confrontation to, prohibit, with confrontation, people from entering businesses. We've seen throughout the pandemic, most people are doing the right thing. And so most people are vaccinated. Most people are going to show proof of vaccination. There will be medical exemptions. We are not asking businesses to be the judge of those medical exemptions. This is a transition period right now until we have a provincial system that's going to make it easier for businesses to verify vaccination status or exemption. But I expect that people will be reasonable as they have been through this pandemic. I'm asking people to be kind to the employees that are working in businesses where they're going to now need to ask you for proof of vaccination. It does require patience as businesses figure out how to do this and implement their processes.
Thank you so much.
So thank you. That is all the time that we have for today. C'est tout le temps dont nous disposons aujourd'hui. Thank you and have a great day. Merci. Nous vous souhaitons une bonne